Good afternoon and welcome to the Activity-Based Funding Conference for 2022. My name's James Downie. I am the CEO of the Independent Hospital Pricing Authority and I'll be your conference MC for the next 2 days. Before we open the conference, I'd like to hand over to Uncle Cheyne Halloran to provide an acknowledgement of country. Uncle Cheyne's a proud Aboriginal man of the Wolagalu and Namich clans of the Ngunnawal Nation. His extensive experience working with Aboriginal communities around Australia in the areas of language and culture, specialising in language field recordings and community consultation. Uncle Cheyne is passionate about the capacity of technology to facilitate language revival, and we're grateful to have him opening the conference.
Yuma, Yumalundi, Yangu, Ngalawiri, Dunimanyan, Ngunnawal Daurawari. Hello and welcome to anyone joining us on Ngunnawal Country. The Ngunnawal people pay our respects to the traditional owners of the land to where we're streaming today. Firstly, I acknowledge my ancestors and my elders, the Ngunnawal people, who are the traditional custodians of the region encompassing Canberra, the ACT and surrounds. The Ngunnawal people pay our respects to our traditional neighbours, the Gurungara to the northeast, the Wolagalu to the south, the Wiradjuri to the west, the Yuin to the east, and the Ngarago to the southeast. We know that a welcome to country is an ancient Aboriginal protocol that ensures that once welcome, your body and spirit are protected whilst on another's land. The Ngunnawal people welcome you and call on our ancestors to provide you a safe journey during your time on country. I acknowledge any Aboriginal and Torres Strait Islander people joining us today. I'd like to acknowledge and pay my respects to all elders, educators and leaders, both Indigenous and non-Indigenous, whose knowledge and experience of the past will be valuable in helping guide our modern society to shape an inclusive future for all. Yinjumara, Daura, Yinjumara Gudawa. As we show our respect for the land, the sky, and the people around us, we know the same respect will be shown towards us. Language is our connection to culture and country. Country is the term we use to describe the lands, waterways, and seas to where we're directly connected. There's an intricacy to how we use it, about law, place, custom, spiritual belief, cultural practice. It can be about kinship and identity. Language and communication is central and vital to those connections. I like to speak about the language of my ancestors to show the cultural practice, diplomacy and inclusivity that's been practiced on Ngunnawal land for many millennia. Aboriginal and Torres Strait Islander people, both individually and collectively, as a community, define themselves by their culture and not just the colour of their skin. Today I'd like to speak about two words. The first word is Yinjumara. It's a word commonly translated from Ngunnawal to English to mean respect. But it's more accurately defined as a lifestyle philosophy of respect and harmony. Traditionally with the land, with the environment, and with the people around you. The second word is Naraganawali, which means to come together for the well-being of all. It's respected in our culture and in many others that our elders and teachers guide us by providing a safe space for questions where they both speak and listen, to provide a place or a platform to share knowledge and culture. As our ancestors and elders have taught us, we move forward addressing every issue that arises. They teach us that we are always a student and that we have a cultural and social obligation to help as much as we can in the journey of younger generations. We're taught that empowerment through our journey of education and innovation allows us to identify the future leaders that we elect to speak for us, so that we can build capacity and promote sustainability, positive change and self-determination in our communities. This is important to ensure we one day reach a place of harmony and of equity where we can play our part in modern community whilst maintaining our traditional values and practice. Yumulundi, Galambani, Gadjali, Yinjumara Winange. Welcome, may we all find peace and respect as we look, listen and learn together.
Thank you, Uncle Cheyne, for a wonderful acknowledgement of country. So again, good afternoon and welcome to the Independent Hospital Pricing Authority's Activity-Based Funding Conference for 2022. Unfortunately, this year we weren't able to meet in person. We had planned to be in Brisbane, but as you all know, things are still a little unpredictable, and so we had to make the difficult decision earlier this year to move to an online. But there are benefits. It means we have a lot more people joining us, and as of this morning, we had over 2,200 delegates who have registered for the conference. It's great to look through the list and see so many familiar names, as well as lots of new people, and a particular welcome to all those who might be attending for the first time. You're very welcome, and I hope you have a great time. We've got a really good program in store this year. Since activity-based funding was introduced in 2011, we've seen what is possible with improvements in quality and safety measures, as well as a significant reduction in the rate of growth of costs in hospital services. With our theme in mind, innovation and collaboration, activity-based funding for sustainability in healthcare, it's time to start looking further ahead. As we look at the 2020 to 2025 addendum to the National Health Reform Agreement, this agreement is allowing us to incorporate innovative approaches into our work, and I'm confident will lead us into the next generation of hospital funding that is both efficient, transparent and flexible. As I'm sure you know from looking through the program, we've got a really comprehensive lineup over the next couple of days. Over the past year, the team have worked really hard to bring you varying perspective and expertise, and I can't wait to hear from all of the speakers. We're very lucky this year to have 3 keynote speakers. Joining us from New Zealand and highlighting the importance of Indigenous perspectives in the sustainability of healthcare is Dr. Amorhea Bolton, who is the Director of the Waka Kui Research Services and Adjunct Professor at the Faculty of Health and Environmental Services at the Auckland University of Technology. We then have joining us all the way from England, Mr. Martin Campbell, the Deputy Director of Payment Development for NHS England, and Mr. Campbell will share his insights into developments in the hospital payment systems for the NHS. We also have experts joining us from a little closer to home. We have Professor Paul Glasziou, AO, who's the Director of the Institute for Evidence-Based Healthcare at Bond University and was previous Director of the Centre of Evidence-Based Medicine in Oxford. Paul will look at the many ways which we can increase quality clinical care using the volume of research that already exists. And I know this will be of interest to many of you. I hope you have your questions prepared for the Q&A sessions after each presentation, and no doubt we will have some lively discussion. This afternoon we have our first panel hosted by someone known to many of you, Alpha D'Amato, who is the CFO and Deputy Secretary of Financial Services and Asset Management at New South Wales Health. And that panel is focused on international perspectives on ABF, and we have a number of international speakers joining us for that. And then tomorrow afternoon, we have another panel discussion moderated by World News presenter and journalist at SBS, Janice Peterson, and we'll focus on the clinical and strategic improvements in health through ABF. We have 4 plenary sessions this year, the first taking place right after this, which will be delivered by the new chair of the Independent Hospital Pricing Authority, David Tune, who will reflect on IHPA's achievements in the first 10 years. A recent addition to the program, we have 2 of IHPA's key leaders in pricing and funding, Professor Kees van Gool and Dr. Sarah Neville, and they'll be launching the new national benchmarking portal this afternoon. It's a project that's been in the pipeline for a number of years, but will for the first time provide open access to public hospital cost and activity data to anybody who'd like to access it. Tomorrow, a real highlight will be hearing from Professor Anne Duggan, who is the Chief Medical Officer at the Australian Commission on Safety and Quality in Healthcare, and Professor Ruth Hubbard, who's currently ranked in the top 3 frailty experts worldwide. I would particularly like to acknowledge everyone who's put in an abstract, and thank you for taking the time. Without those abstracts, we wouldn't be able to host such a high caliber conference. The format of the abstract sessions are a little different this year. I hope you've had a chance to look at the abstract presentations that are already in the portal and were made available in advance. And that gives us a lot more time tomorrow for Q&A. Sorry, these make up the concurrent sessions held today and tomorrow afternoon. As we open the conference to a global network for the second time, I'd also like to acknowledge delegates joining us from many different time zones. So some of you, I'm sure it's late in the evening, and for many of you, early in the morning. But I know we have a number of delegates from Saudi Arabia, the United States, the United Kingdom, Germany, Ireland, Canada, Singapore, Sweden, Qatar, and Croatia. And the risk of me listing countries is I will always miss one. So welcome to all of you. There will be an opportunity to vote for the best presentation at the end of the conference. So please do take time to vote for the presentation that you were able to get the most important learnings from. So before we join the first session of the conference, I'd like to just run through some housekeeping. At the end of every session, a survey will pop up, providing you an opportunity to give feedback. Please let us know what you think. We do use those survey responses to plan for our future conferences. After you've completed the survey, you need to click the Back to Timeline link at the top right-hand corner of your screen to be taken back to the conference program. You then click on the Join button for the next session. If you have any questions for presenters, there's a live Q&A function on the right of your screen. Click on it to open a text box where you can type and submit your questions. You also see other questions from other delegates and upvote those with a like button, and that pushes them to the top of my list and makes it much more likely the question will get asked. As always, for all you millennials, please push this on social media. Please don't forget to tag IHPA on LinkedIn and Twitter, and we'll be sharing your posts over the next couple of days as a way to try and keep the conversation going and open up to a broader community. And finally, if you have any problems or issues at all during the conference, then please click on the live support button at the top right-hand corner. We'll be able to chat to one of our support team. So now that's it from me. Let's head back onto the timeline